Hi, hi. Good afternoon. And this is your county executive ed day, and I'm laughing because we just had a little incident here where my deputy county executive and a couple of other people from the office were in the office behind me speaking at a very high level, and I got out and said, "Guys, gotta be quiet. I'm going to start a Facebook Live in a few minutes." And we're speaking to the people of Rocklin, and the comment that came out of the room was, "It's good to know that you could hear me." so, so we got a bit of a chuckle out of it. Anyway, I'm back in business again. I got a week's reprieve from my projected time with the sling after my shoulder surgery. I'm going to thank my doctor for giving me that latitude. It feels very good to be a little more loose and not as tied up. So we're feeling good today. But before we get into any of the questions that you have called in, I want to update you on our enforcement efforts currently underway here in Rocklin County and where our numbers currently stand. For enforcement, as I said last time we were together, there's a two-pronged approach. New York State's efforts under the Cluster Impact Action Task Force the governor put together, and your county's efforts directly, the ones that we go out on, the complaints we handle directly. We've contributed 15 personnel, county employees from the Department of Health, our Office of Fire and Emergency Services. We've also sent people from our Consumer Protection, and they've joined the New York State Police State Task Force. These county employees join with state personnel and state police. They patrol the areas within the red and the yellow zones that have been delineated by the state of New York. We have asked the state task force to provide us with all of the data on their actions over the past couple of weeks. We have yet to get a response back from them because we haven't been asked questions by all of you. And you have a right to know what government is doing. It's a different level of government, albeit that's true. But we've been insistent that we do get some information so we can report back to you what the state has been doing. Our inspectors only make up a fraction of the task force, so we do not have a full grasp of the totality of what the enforcement effort is. So I'm hopeful we'll get some information soon enough that we can report back to you. As to our local efforts, which I can share specifics about, we are making a difference. That is clear. Our inspectors from the health department, the Rocklin Codes Initiative inspectors, those are the ones who have been out before dealing with slumlord housing. They have investigative experience. They know how to do this. They're currently enforcing the commissioner's health orders regarding face masks on buses and in schools. This order requires all educational institutions, school-age child care programs, adult learning programs, including colleges and universities, and school transportation companies that are responsible required to ensure that all children, students, and faculty and staff who are able to medically tolerate a face covering cover their noses and mouth with an acceptable face coverings at all times, other than obviously the approved mask breaks that are given in order to provide some comfort to our young ones, where students can maintain social distancing, of course, during that period of time. One footnote. The child care for child care, children to pre-K are excluded. They're excluded as per the State Department of Health guidelines that issued on June 26 this year, 2020. Many have asked, how is this order different than the governor's orders that were issued as emergency orders some time ago? And the difference really is quite simple. The governor's orders allowed for a fine to be issued to a person who was not wearing a mask. Sounds simple. Obviously, if that occurs and the person does not want to comply, that police officer would write a summons or write a ticket. Clearly, that's not helpful when we're dealing with somebody who is in charge of children. We're not going to give an 8-year-old child, a ticket for not wearing his face covering. Clearly, the responsibility lies elsewhere. So the commissioner's order gives our inspectors the ability to issue fines to businesses and institutions responsible for the safety of our children. That is the main difference. Since March, we have been extremely limited by the governor in terms of actions that we could take locally related to COVID-19, but his recent Executive Order 202.68 clarified the authority of the Health Department to act in respect to his executive orders and the New York State Department of Health regulations. As of October 26th this year, the Rocklin County Department of Health has received 97 complaints about 57 separate locations. The reason being some locations have received more than one complaint. Excuse me. Inspectors have completed 64 inspections to date. On 60 of these inspections, no violations were ascertained to have been there. The latest violation that we've added to the list is Yeshiva Tefera Shmel, 282 Spook Rock Road, Suffern. They were cited on October 23rd and served on October 26th. As we said before, there is a long process to how this is done under the Health Commissioner's orders, but it is done. In this particular case, the inspectors observed approximately 12 to 15 males between the ages of approximately 13 to 16 years of age standing outside the school. Only 2 were wearing masks and face coverings, standing less than 3 feet from one another. We have issued violations prior to this one, and will continue to take complaints and conduct inspections. And the number that you can call, John will be putting up, John Lyon, our communications director, will be putting up the email address for reports by email. Excuse me very much. Excuse me. But for a phone call, you can make a phone call during business hours. You will get messages. You can leave a message if need be at 845-238-1956. 845-238-1956, and you can make those calls directly to our County Department of Health on their hotline. Now, let me update you on our latest numbers. As of yesterday, October 26th, we had 915 active cases here in Rocklin. Now, it's noteworthy to see that this is down from the number of cases 18 days ago on October 9th, which was 1,649 cases. So a big difference, roughly 700 cases difference in the two in less than 18 days. So the decreases show that we're heading in the right direction. That's the increased presence of the New York State personnel and the enforcement actions taken by the Rockland County Department of Health are sending a message that we expect compliance. Most people are complying, a few are not. Simply put, we're not going to tolerate non-compliance and have the entire county's health and economy risk because some people just don't get it. Thankfully, the hospitalizations have remained steady. They've been leveled off about 20 right now on average daily. We have, and most importantly, you've heard some stories from other states in particular. We have plenty of capacity to treat patients here in Rockland County. You may remember we were approaching, I think, roughly 400 during the bad old days of the COVID-19 crisis. We will keep a close eye on these numbers as we always have, and as we move through the coming weeks. We recognize the criticality of certain numbers that we're seeing, and we are responding to them as we need to. This is where I turn my everything over to my Director of Communications, John, who's standing by. He's been fielding your questions, so we can go through that. John, what do we have?
Okay. Before I get into the questions, I just want to mention the numbers that the county executive is talking about today are publicly available on our dashboards, which you can view by visiting rocklingov.com and going to the dashboard hub. There's a bullet point there. You really can't miss it.
Okay.
Those are updated during the day throughout the week. So thank you to everyone who wrote in. I think we're doing a pretty good job with these because we only received a couple of questions today. So we must be getting the information out there.
I hope so.
I thank everybody out there for making my job a little bit easier today. So the first question is, have there been any discussions when COVID-19 numbers go up on implementing a curfew or any different type of restriction? The person wrote in that this might be a better alternative as opposed to closing down businesses completely.
Yes, and it's a very, very good point. Anyone who knows the way I function, I don't go into a battle without at least 1 or 2 backup plans. That is where we are right now. So we do discuss many different options. This is exactly what we did during the measles crisis and was successfully concluded because we thought outside the box. We did not limit ourselves to what options we could use, and we utilized every tool at our disposal to do that. So normally that is something that we would consider if it could be implemented locally, but here's the rub. On March 18th, 2020, it's hard to believe it was that long ago, in Executive Order 202.5, the governor took away that executive power at all levels of government. The mayors, county executives, they no longer can issue those orders anymore. The order said, and I'm going to read this here, no local government or political subdivision shall issue any local emergency order or declaration of emergency or disaster inconsistent with conflicting or superseding the foregoing directives. And it goes on, this refers to executive orders issued under Section 24 of the executive law. That's the law that allows me to issue emergency orders, just like it allows a governor to do it at the state level. We did that here during the measles crisis. We did that here, obviously, with this crisis, and we did it during a snowstorm. That was, we getting 2 or 3 inches of snow an hour. It gave us a chance to clear the roads for about 6 hours. We rescinded after 6 hours when the plows got out there to do their job. So the governor has made it abundantly clear that only that mayors and county executives can suggest things, but only he can issue orders. He was quoted in an article in the paper maybe 10 days ago. So this is what we're dealing with. You may remember that there were things that we did here in Rocklin, we proposed, or we issued orders on here in Rocklin County. One thing we proposed as an order and we sent forth was an anti-hoarding law. I'm committed to the fact that if we had done something back then, we would not have difficult time getting toilet paper, for example, and other items. That was rescinded. We were looking to make it more orderly to go shopping and much more safe to go into stores and shopping. Things that you've seen now that many stores have picked up on, one-way aisles, making sure not so many people are in the store at any one given time. Those are the things that were in that order as a mandate. That was rescinded also. So we had things that we had put forth early on, and unfortunately we were not able to continue with them. But I will continue to speak to the governor's office about minimizing the financial impact of his restrictions, and will continue to advocate on behalf of any business or school that provides my office with compelling and concrete information about why they should be exempt from the governor's orders and restrictions. And again, if it'll be your job, if you're an organization, to make that case to this office. When we review it, if we feel that it makes sense, it's something that we want to see happen, and we agree with the position you're taking, we will write a cover letter, much as I did recently, more than once, on a variety of businesses and industries. We'll send a cover letter up to the governor. We'll bring it up at our daily call that we have with the governor's staff, and we will advocate for you. Again, we cannot automatically do it, but we certainly have no issue, no problem whatsoever in advocating for the people, the businesses, or the schools here in Rocklin County, because that's really what this job is all about when it comes down to it. If you're having specific difficulties, we need to hear from you. If we do not know about it, we cannot act on your behalf. So if you have a case to be made, by all means, feel free to communicate with us, and we will do what we can do to help you out.
Okay. And before we get to the next question, I'd just like to address something that's come up in the chat a couple times, with people saying we should not listen to the governor's restrictions or orders. As much as we may or may not agree with what you're saying, we cannot do that. It would be illegal for us to do so. And the governor has actually threatened to withhold funding to localities that do not go out and actively enforce his guidelines and restrictions.
And I'll add one more thing to it, and this has happened, okay? Again, it's real easy for me to turn around and play the politician and get on what people want, give people what they want to hear. That's simple. Leadership is tough. At the end of the day, you trust me, and you take action based upon what I represent. What happens when you have a state license? For me, maybe because you are a hairstylist. Maybe you're a restaurant with a liquor license. What do you do when the state comes down and takes our license away? You think you had tough times before? Now you cannot sell liquor at your restaurant. You've lost all that money. You can't style hair anymore. There are a lot of things that businesses here in Rocklin County that have state permits. Those permits have been pulled in the past on companies that have ignored the governor's directives. The governor's directives are law. We may not like it, but I'm not going to lead someone down a rosy path with a false promise. If you choose to take a chance, that's entirely up to you. But to me to go out and suggest that to people without giving them the other side, as John just mentioned, also even losing local funding, it would be unfair of me, and that would be wrong for me to do.
And we've talked about this before. There is an entity with authority to make changes to the governor's rules.
New York State Legislature. We have to realize something. The state legislature gave the governor the unbridled power he has. And there is no longer 3 branches of government now. We have 1 branch of government. That's what we have. And in a time of crisis, you know something? Limited use of executive power is a good thing. I'm not going to quarrel with that. But more and more often we're finding this to be problematic. And at the end of the day, what happens now is that the state legislature has it within their authority to suspend the ability for the governor to act. I think they gave him the ability for a whole year to act as he's acting now. And again, if you do not like the way this is being run, communicate with your assembly person, your state senator, and demand that they take action, because that's how government works.
Okay. On to the next question. What's your response to some media reports that have been coming out of Orange County? That people who are sick with COVID are refusing testing or not going to the doctor, not getting tested, and that therefore the numbers that we're seeing are not accurate.
Okay. Right, that's a good question. I mean, I've seen this in social media myself. You know, look, we've checked with our Department of Health, and we have seen a report about what's happening in Orange County. I made a personal phone call to Steve Newhouse, who's a very good friend of mine, the county executive there in Orange, and there is seemingly some substance to what we're hearing from Orange County. But that said, we maintain contact with our medical providers, the Department of Health does. We have not been contacted by medical providers telling us that people who are showing symptoms or symptomatic with possibly COVID are refusing tests at any kind of large scale. You may have one or two people. We have not gotten one report of this happening. And we do ask, just to be clear, obviously we don't function within a vacuum. I saw one comment on Facebook where somebody thought the county government was clueless. Well, it's easy to open your mouth in front of a keyboard. But the fact of the matter is a lot of work that goes on here to make sure that we're okay. We didn't become the healthiest county in the state of New York for 2 years running because the health department was clueless and didn't know what to do. So we are aware of these things. Obviously, if you're seeing them, we're seeing them. We do check to make sure as best we can that things are being done properly. We have had not one report of anyone not taking a test. I think you got to realize something. Medical professionals, doctors, if that happens, they're duty bound to let us, the Department of Health, know what's going on. So it just does not seem to be right now a legitimate issue, because we are seeing a very high level of testing also across this county. I look at some of the commentary that there's intentional avoidance of taking tests. Well, the reality is this: when you stop taking tests, you're going to actually bring the numbers up, because if you are not symptomatic and you avoid testing, again, that's going to skew the numbers also. Also, it's good to know that the numbers that we get, there's been some commentary made that the placebo is out there, or somebody's avoiding testing. The problem with that is a presupposition that the numbers you see on a daily basis are from that day. They're not. Those are when they're reported in. It could be 2 or 3 days, sometimes 4 days. They could be batched. It's when you see that number for the day, it's a good guide, obviously, because it all balances out at the end of the day. But it doesn't mean that those reports are from people who tested on that specific day. So I kind of laugh when I see somebody somebody makes an issue when it goes to 5.8 in this crisis, or this renewed crisis, and the comment is made about, see what's going on. Then when it's at 1.6, there's nothing said. So I mean, look, some people really are just get overdone over this. They really do, and again, we're very open here. We will explain to you what the numbers mean. We've had other situations where we've been on here speaking directly to you and said, look, this is what's happened. We've explained the entirety of it all, and that's the best we could do. The only thing we can do is share honest things that happen in a transparent way, and that's what we do here in my administration. We also have to deal with issues such as the weather, holidays. It impacts people's availability to go and get a test. So there's a variety of things in here. That's why they try to use the rolling averages to get a better sense of exactly what is truly going on. Because looking at one day or even day to day really is not a clear indicator of where we are.
Absolutely. So that does it for the questions. But before we wrap up, there's a few additional topics that I think we should mention here today. Since we've talked about it quite a bit in the past, how did the census response turn out?
Okay, I'd love to get 100%. I didn't get 100% in school too often, but I shot for it. I tried. But the nationwide rate here, nationwide rate for the census was 67%. New York State-wide rate was 64.2%, and our rate here in Rocklin was 71.1%. So we surpassed everyone in the immediate area except for Nassau and Putnam counties. I probably will have to buy Marianne Odell and Laura Curran a drink now because they beat me. Make one of these bets like they do in football. But we make light of it. But again, I want to thank all of you who did engage in this issue because it's very important. It's a matter of millions of dollars of funding, and that's something especially that was sorely needed for the county of Rocklin. The information from the Census Bureau shows that the field census workers were able to count many of your hard-to-reach areas. I want to thank everyone again for their help and for giving us a hand, both and spreading the message around. Other people picked up on this, shared Facebook messaging, got the word out. So I want to thank everybody who helped it, and it was really a very positive experience. Thank you very much.
Okay, and we're coming to the end of October. I don't know where the time has gone, but November is National Adoption Month. Is there anything being done to raise awareness around this issue here in Rocklin?
Yep, it is. And, you know, I have to give our Department of Social Services a kudos for the work they do in the service and protection of our children in particular. They do an amazing job. Joan Sylvester is a commissioner of DSS, heads up a staff of tremendously caring people. And we're really blessed to have them here in Rocklin County. Right now, what they've done, they've joined with Wendy's locations to celebrate National Adoption Month and to increase the awareness of the need for foster families. Some may or may not know this, but the founder of Wendy's, Dave Thomas, himself was an adopted child. So he understands this better than most of how important that is. This is the 9th year in a row that Wendy's and Nanuet will be in West Haverstraw. Sorry, make sure I don't leave that west out because I'll get the mayor mad at me. Hey Bob, how you doing? I'm sure you're watching. But they'll be collaborating with our Department of Social Services in this effort. This year, the adoption celebration will be held on November 18th. It will be conducted somewhat virtually for the obvious reasons we're dealing with. Rocklin County adoptive families will pick up their food from either Wendy's and will then participate in a virtual support group regarding self-care. Info sessions regarding how to become a foster parent will also be held virtually by DSS. They call them the Home Finding Unit. The sessions will take place from 2 to 3 p.m. and from 5 p.m. to 6 p.m. on November 18th. I'll repeat that. Mark your calendars if you have even the passing thought that you might have an ability to have an impact, a positive impact upon a child. November 18th from 2 to 3 p.m. and then later that day from 5 to 6 p.m. Foster home recruitment is a key element to the success of the adoptions in Rocklin County. In 95% of the cases, the adoptive parents have become the child's, have been the child's foster family. Over the past 8 years, around 70 children have had their adoptions finalized, and they were adopted by the foster families. And fostering a child is an opportunity you can make a real difference in a young person's life. I coached for many, many years in this community. It's probably one of the things that gave me more joy than anything else to help mold young people, on the field of play at least. And teachers out there in particular know what I'm talking about. It's a very special thing to have an opportunity to have that impact upon a young person. This is truly a special gift for both you and for a child. And I urge anyone who's ever even thought of it, give us a call. Get some more information and see if it's a fit. Again, it's just really a golden opportunity. And if you want additional information on this, you can contact our Child Services Unit by phone at 845-364-3521, 364-3521, and we will post some information in the comment section at the end of this video.
Okay. And the last question I have for you today, early voting is going on right now. It started Saturday, it runs through Sunday. How long does this last?
Wait a second, I happen to have it right here. I wasn't expecting that question. Actually, there's 9 dates for early voting. We've already gone through a couple already, but right now, early voting is in progress. It'll be every day this week, including Saturday and Sunday. The Board of Elections at 638-5172, as I recollect.
I'll check and make sure the correct numbers in the comments section.
Yes, 638-5172, I believe it is. So again, it's varying times during the rest of the week. That's one way you can vote. You have an opportunity to vote through absentee ballot. It's something at this juncture, you probably have to pick that ballot up at this point. So if you're looking to do that, you can vote absentee, and you can put down as your temporary illness as COVID-19, and it will accept the ballot. It will essentially be a no excuse needed ballot. And also you can go on November 3rd, Election Day. there are a lot of there's a lot of conversation and commentary about what's going on. Why do we have such long lines? There are a lot of reasons. One of the simplest reasons I can share with you immediately is that we have just early voting is relatively new here in Rockland County. The last time we did early voting was a primary election. So you had X amount of people covering the polls. You have typically roughly a 12% turnout for primary elections. So it's not a lot of people. Well, national elections, federal elections, it turnouts are roughly 65%. So it's about 4 or 5 times more than a primary election. So if you take that and add that to the mix, you have many, many more people coming to those polling places. There are only 4 polling places in the entire county. Much unlike Election Day, you have your own polling place. You can go to Clarkstown Town Hall in New City. You can go to Haverstraw Town Hall for those in North Rockland, Stony Point, and Haverstraw on Rossman Road. You can go to Ramapo Town Hall on just to east of Airmont Road on Route 59. Or you can go to Orangetown Town Hall, which is on Orangeburg Road at Dutch Hill Road. So that's also a contributing factor right now. There's only 4 locations that people can go to. People concerned about getting sick. They're going early and they're finding long lines, but again, they're a distance, that's for sure. The towns are doing a great job in trying to make this work as best we can. But right now, we don't, last time we saw the election, we did not see a load of new voters coming out. It was pretty much the same people taking the convenience of the early voting and using that. So we don't know how this is going to play out, but again, there's a variety of ways you can vote. It's critically important that you're heard, that your voice is heard, and you've heard me say this before. It may be corny, but that vote that you have, the right to cast, was secured by the military, those who gave their lives, and men and women who fought and died to give you that right to vote. Some of you may remember after Saddam Hussein was toppled, the Iraqis went to vote and they put their hand in a jar of purple paint, and they came out of their polling location very, very proud, the fact that they voted. It's a very special thing. It's a gift. It's a gift given to you by the veterans, and it's protected right now by the other soldiers who are serving this country, serving around the world, and our members of law enforcement here who are protecting us. So please don't take it lightly. Learn the issues, give it some thought, make the best judgment you can, and remember that this is a republic. It's a participatory democracy, but it's only as good as you make it. And I want to see as many of you engaged as possible, because the more that you know about what's going on in government, the more honest and open and better a government can be. And that's very, very important as far as I'm concerned, and I'm sure you'll agree with me. So with that, we're done?
We're done.
Okay, listen, thank you very much for joining in today. We will probably be back more than likely next Tuesday again, but we will get something out so you are well aware of what the date and time will be. With that, this is County Executive Ed Day signing off.